Hello and welcome to the Pathfinder Show. I'm Toni Gorman, your host. Today I have sitting with me Rob Kinnberg. He is the owner of the Phoenix Recovery Center. Welcome to the show, Rob.
Thank you. My pleasure to be here.
Now, before we talk about your recovery center and addiction today, I really want to hear your story and how you got into this industry. I know you have a story of your own, so please share.
Sure. I'm an alcoholic and a drug addict. I'll tell you a little bit about myself and how I got to where I am today. I'll share my experience, strength, and hope.
Thank you.
I grew up in Buffalo, New York. Parents were very supportive. I was captain of the swimming team. I was popular in school. I had my first drink at 9, my first drunk at 14, and I liked alcohol. I kept 100 proof miniatures in my locker in high school. I don't know where I got them from, but I did. When I finished high school, I went to college, went to the University of Akron. I was almost thrown out of school my freshman year because I had a case of beer in my dorm room. Eventually, I joined a fraternity. If anybody has seen Animal House, I joined Animal House. That's the fraternity I selected.
Okay.
It was every Thursday night. 2 kegs of beer, Little Annie and the Orphans was the band, and we partied through the weekend.
Wow.
I drank myself out of college after 2.5 years, and I joined the United States Navy. I was 124 in the draft, and I did not want to go to Vietnam, no disrespect. Joined the Navy, became a storekeeper in the Navy. When I got called up for duty, I was at Brooklyn, in the Brooklyn Navy Yard, and they ask you what you would like to do, and I said, I'll take shore duty anywhere. Number 2 fuel oil makes me nauseous. 3 weeks later, I was in Antarctica. I lived in Antarctica. While I was in Antarctica, I got a job when I wasn't offloading planes and ships. I was a bartender in the officers club. It made sense to me. I got paid to get drunk every night. After I got out of the Navy, I went back to college. I went to Rhode Island College, have a bachelor's degree in biology with a concentration in physics and chemistry. Got my degree. During that time, I got married to my high school sweetheart, who was a cheerleader and a model. And when I finished up my undergraduate work, I decided that I wanted to become a hospital administrator. With that, I researched hospitals in the area in Rhode Island, and I was told that if I wanted to run hospitals, I should go to the Medical College of Virginia.
Okay.
I got in my car, went to Richmond, Virginia. I sat with the director of the program. He said, move to Richmond, Virginia, become a Virginia resident, take a course and work in a hospital. I took a job as a utility aide and a unit secretary at the Medical College of Virginia Hospital. It was a 1,000-bed teaching hospital. Eventually, I was the business manager for the operating rooms. We had 23 operating rooms, and I was the business manager. During that time, I was drinking, and my drinking was out of control. I'm a closet drinker.
Okay.
After that, I got a job. I went to graduate school.
Okay.
And then I got a job with the largest hospital management company in the world, Hospital Corporation of America.
Okay.
And I became an assistant administrator at a hospital in Richmond, Virginia. My drinking was taking over my life at that point. My family, my wife and I had 2 children at that point. My wife and my children would go on vacation, and I would tell them I'd come back and work, and that they should go on vacation without me. That was an opportunity for me to drink unencumbered.
Okay.
I also need to share, when I finished up my undergraduate work at Rhode Island College, I got a part-time job. I got a part-time job in a liquor store. I see that now. I didn't see it then. I always had alcohol in my life. Eventually what happened was I started to work in the hospital business. I was an assistant administrator at a hospital in Richmond. I then moved to New Orleans, Louisiana, and built a hospital for a group of doctors.
Wow.
And when we helped design the hospital, I put a bar in my office.
And they didn't see that you were doing that?
No. No, they didn't. They didn't see. And I had a bar in my office. And unfortunately or fortunately, I would say I have to work late, and I would drink in my office, and the nursing supervisor would wake me up at 2 o'clock in the morning and send me home. I see it all now. I didn't see it then.
Okay, let me ask a question.
Yeah.
I want you to don't lose your thought, but
Yeah.
here I'm hearing you say that you grew up in a healthy home. So
Yes.
there was no propensity
No.
for this.
No,
You just liked alcohol.
I liked the way it made me feel.
Wow.
Yeah.
Okay.
And
Go on.
Okay, and so then I left the hospital in New Orleans, and I went to work in New Jersey at a hospital in New Jersey.
Mm-hmm.
And I worked there. During that time, I started we started to drift apart, my wife and I.
Mm-hmm.
And part of it was my alcohol.
Mm-hmm.
Eventually, what happened was I took a job in medical sales here in Annapolis, Maryland.
Okay.
At that point, I was going through a divorce. I was living in Annapolis. My ex-wife and my children were living in Columbia, Maryland.
So now you had a reason to really get it on.
I did,
Mm-hmm.
and I lived alone. And eventually, what happened was I got divorced, and I moved to Miami, Florida, in the early '90s.
Mm-hmm.
And it was in the age of massive quantities of cocaine. And I got introduced to cocaine in Miami, Florida, when I was doing a hospital down there. And I eventually, poor judgment, leadership problems because of alcohol and drugs, I was terminated from my position, moved back to Annapolis, Maryland, and did a 2-year alcohol cocaine run in Annapolis, Maryland.
Okay.
On March 4th, 1994, I was homeless on the streets of Annapolis. Shorty and Andre wanted their money, and Pancho had my car, and it weren't fun anymore. I lost absolutely everything.
Let me ask you this.
Yeah.
Did you think while you were drinking, did you ever think that you would graduate into cocaine or anything other than alcohol?
Alcohol was my primary drug of choice,
Mm-hmm.
but cocaine took me to homeless.
Okay.
Once I got introduced to cocaine, I was in
That
love
was-
with it. As long as I had money, I would get cocaine.
Okay.
Yeah. Cocaine is a psychological compulsion where alcohol is a cellular craving. You drink alcohol and you need alcohol just to function in society.
Yeah.
With cocaine, it's a psychological compulsion. Once you take that first hit of cocaine, you can't stop. The downside with cocaine is after you run out of money, if you get 8 hours sleep, good to go.
Mm-hmm.
With alcohol, you typically have 2 to 3 days of withdrawal after an
course.
alcohol run.
Okay.
During that time,
Mm-hmm.
I met a young lady in Houston, Texas, when I was working at the medical surgical supply company in Annapolis.
Mm-hmm.
And she lived in Houston, and we became friends, and we started dating. We had a long-distance relationship.
Mm-hmm.
By the way, she's my wife, and she's a wonderful lady.
Good stuff.
And anyway, what happens is I left Miami, came back to Annapolis, Maryland, was vice president of the same company I worked for before,
Mm-hmm.
did a 2-year alcohol cocaine run, and ended up being homeless.
Wow. How long were you homeless?
One day, what happened was my ex-wife, I was destined for the Lighthouse Mission on West Street in Annapolis.
Mm-hmm.
And my ex-wife agreed to let me live in her basement till I found a bed at a VA hospital because I didn't have any insurance and no money. And I'm grateful for that. I went to Perry Point in
Perry Point is?
a VA hospital
Okay.
in Perryville. Went to Perry Point, was there 2 weeks.
Mm-hmm.
And during that 2-week period, at 44 years old, I realized that I had no idea how to live life on life's terms. I used alcohol and cocaine and other substances to manage my life. I didn't know how to manage my life.
Mm-hmm.
The term that I use oftentimes with my clients at my treatment center is, invariably I would make the wrong left-hand turn.
Okay.
And the next thing I knew would be 3 days later.
Wow.
Because the compulsion to use would overwhelm me. I went to Prairie Point, and after 2 weeks I realized that I was not able to function in society. I knew no more how to have a relationship with another human being. I didn't know how to have intimacy with anybody. I had acquaintances. I didn't have people that were close to me. I wouldn't let people in.
So, but when you were drinking and doing cocaine, you were able to do that, or you thought you were doing it. You were
Yeah,
able to have intimacy and,
yeah,
and have relationship
yeah.
and
It
things
was
like
quite. They were acquaintances and people that I could use for my own personal gain.
Okay,
Yeah.
got it.
Yeah. So I'm at Perry Point 2 weeks later. After the first 2 weeks, I went to my counselor, and my girlfriend at the time, who's now my wife, said, you ought to consider a halfway house. I figured I'd do my 28-day tip and then go out and conquer the world again. And I went to my counselor, who used to be a house manager at a halfway house. I went to Sean and I said, Sean, would you consider me a candidate for a halfway house? And he says, I do, and do I have a place for you? He sent me to a halfway house in Bel Air, Maryland.
Okay.
And ended up going to the halfway house, made a commitment for 6 months, ended up staying there 10 months. My first job in recovery, I was a pilot. I mucked stalls in a horse farm.
Oh, okay.
I took horse stuff and piled it here and piled it there. I made $5.50 an hour mucking stalls on a horse farm.
Wow, that gave you a lot of time to think.
It did give me a lot of time to think, and I will tell you that that first paycheck was $68.72. And I cried when I got it because it was an honest day's wage for an honest day's work.
And you valued it.
And I valued it, that's correct. And that in part is the transition that I went through, where I became grateful for things, little things that I had in life, where in active addiction I wasn't grateful for anything.
Nothing, yeah.
I was totally self-centered and so totally self-consumed.
Right.
So I finished up at the halfway house. I stayed in contact with a lady in Houston, Texas,
Okay.
and I began to develop a relationship with my children from my first marriage, because I had lost them.
That's right.
And eventually finished up the halfway house after 10 months and went to work at Father Martin's Ashley in the
Okay.
addiction field.
Okay.
And I started out in the admissions office, then I ran their outpatient department, I was in the clinical staff, and I was the director of operations at Father Martin's Ashley. I worked there for about 9 or 10 years, and an opportunity became available to me to start my own treatment center.
Oh,
And that's what
okay.
I did.
Okay.
Now, in terms of my addiction and my recovery and the way my life is today, I embrace a 12-step philosophy. I have a sponsor. I have a home group. I go to my home group every Tuesday night. It's a 12-step study group. I embrace the tenets of the program. I believe in it. I live my life clean and sober, one day at a time. I have several gifts of recovery. One is the fact that my children from my first marriage are back in my life. There was a time where one of my children was out of my life for 7 years.
Wow.
I have a granddaughter who's 12 years old that likes her grandpa. I have a wife that loves me unconditionally. She has to, because I'm an imp. And I have a daughter, her name is Cassie. She's 19 years old, going to be 20, and she is a gift of sobriety. She was born when I was in recovery.
Wow.
And she's also a gift because she's my wife's first child. My wife had Cassie when she was 44 years old,
Oh, what a
and I
gift.
was almost 50, so she's a gift for both of us.
For sure.
And today, my life is beyond my wildest dreams.
I know you shared with me, because we've spoken on the phone a few times. I would say maybe early evening, and you've shared with me what your routine is when you get home.
Yeah.
And what you do with your keys, what you do with your phone,
Yep.
and the balance of your day.
I live in a very, in my view, a very structured life. For me, in my recovery, it's the gnats that get me. It's the little things.
Absolutely.
I have to pay my bills on time. When I come home from work, my phone, my pen, my wallet, and my keys go in a bowl in the kitchen. I always know that they're there. I have to hang up my clothes every day. Things that had no value for me when I was in active addiction are very, very important. What I've learned about myself is that I can make business decisions and hire people and do what I need to do in life. But it's the little things that are problematic for me. And so I have to watch that on a daily basis.
So you know yourself.
Yeah.
So now I want to talk about your recovery center, the
Yeah.
Phoenix Recovery Center.
Yeah.
And I wrote down a couple of things, so I don't want to forget. So share with me the approach there and your services, and then we'll
Sure,
get into
sure,
some other
sure.
things.
Yeah, we're Phoenix Recovery Center. I've been the owner-operator since 2005. We're a small private treatment center. We're like Betty Ford or Father Martin's, except we're very small. We're 26 bed.
Okay.
Betty Ford has 120, Father Martin's has 100. It's now called Ashley Treatment Program.
Okay.
And they changed their name a few years ago. But I'm 26 bed.
All right.
And we are private. It's a 4-week education model, medically monitored detox. My medical advisor is a board-certified addictionologist. We are an abstinence-based program, meaning when people leave us, they don't have anything in their system.
Okay.
And we are 12-step recovery-based.
All right.
So the clients that come to see us are, they get off their drugs and alcohol. They learn the behavioral aspects of the disease. The disease of addiction is a disease of behavior. It's not a disease of using.
Right.
If you're an alcoholic, 72 hours after your last drink, you're as sober as you're going to be. If you're an opiate user, 5 to 6 days after your last use, you're as clean and sober as you're going to be. If you are a benzodiazepine user, it's a little bit longer because of the half-life of benzos. But the point is, the easy part is getting off the drugs and alcohol, putting aside some discomfort. The hard part is doing the things you need to do to change your behavior so you don't pick up again. That's where the magic happens. And that's what we teach at Phoenix Recovery Center.
Wonderful. And I understand everyone that works there is in recovery.
That is correct. Yeah.
That's your preference.
Yes, yeah.
Okay.
Yeah. And a phrase we use at Phoenix is that when we talk to families or when about their loved one that wants to come in for help, we share the good news is you can't hide at Phoenix Recovery Center. The bad news is you can't hide at Phoenix Recovery Center because we're only 26 beds.
All right.
And it has a real strong sense of community. And that's the other thing that clients that come to see us say, that the fact that it's small and it's got a sense of community, that they feel more comfortable in that environment. There are treatment centers that have 150 and 200 beds.
And it just may not be a good fit for everyone.
Yeah.
So how do you determine 26 beds? How do you determine who's going to come there? How does that work?
The process is really pretty simple. Typically we get a call. We either get a call from the client itself, him or herself, or it's from a loved one.
Okay.
Or somebody that cares for them, or it could be an EAP, Employee Assistance Program, or an employer, or a friend, or an alumni. We get a lot of referrals from our alumni that have been through, and they refer people to us. We do a telephone assessment. It takes about 7 to 10 minutes. If they have insurance, then we verify benefits and determine coverage. We're a network with all the major insurance companies. We call them back, and if there's an opportunity to work together, we schedule the admission and they come in. When you come into treatment, you're seen by an intake coordinator who does another assessment. You're seen by a counselor who does a comprehensive assessment.
Wonderful.
And then you're seen by a doctor that does a medical assessment. So by the time a client is engaged in treatment, we have a pretty strong history of why they got to where they are to come see us.
So tell me about people that seem to go in and out of recovery centers.
Yeah.
Why is that, or do you even know?
The disease of addiction, it's a progressive disease. It's not a hot gallbladder and you take it out.
Right.
And we are many and varied, and there's things that we bring to the table oftentimes, what I call unresolved core issues.
Okay.
And if
unresolved core issues. Perfect. Okay.
Unresolved core issues. If you don't address those core issues, then that helps to keep you sick. The other thing that's problematic for alcoholics and addicts the first time they come in treatment, they have difficulty with self-honesty. And you've got to be honest, regardless of the consequences. And sometimes we always say the secrets keep you sick.
Right.
And you have to address the secrets. What we do at Phoenix is when you finish up with us, we give you a continuing care plan, which sets forth what we suggest you do for the next 3 or 4 months after you leave us, and we suggest that you do embrace a 12-step philosophy. We schedule the appointments. We make arrangements for you to do follow-up care.
Wow.
The gurus that study people like me tell us that those people that stay engaged in treatment 4 months or longer statistically have a much better chance of ongoing sobriety.
Right.
And so we believe that, and that's why we're diligent about putting together a continuing care plan. And we tell the client, you need to share that plan. It's a written plan. You need to share that with the people that care for you.
Support, yeah. All right, so let's talk about addiction today.
Okay?
And what's going on today. I know
Okay.
there's lots of things out there that's killing people.
Yes.
How can we reach them? How can we help them? And why is it? Or is it just something that's been going on all along and it's just suddenly in the news?
Yeah. Well, in alcohol's been around for years.
Right.
And alcohol is, for many people, the drug of choice. It also was a gateway drug, just like marijuana is a gateway drug.
I know it is.
Because when you take alcohol or marijuana, and you have a predisposition, your judgment is flawed. Your rational thinking is flawed. And if you have the predisposition, or if you've tried other substances, you gravitate towards that substance because the disease tells you it's okay to try this, it's okay to try that. And
also, what did you say earlier? Those unresolved
or unresolved core issues.
core issues. Okay.
Yeah, you can have unresolved core issues that pop up, and then you do what I call make the wrong left-hand turn, and the next thing you know, it's 3 days later. Say, what did I just do? There's $900 out of my bank account, and there's 3 bottles of bourbon in my apartment. What did I just do? But today, heroin is a problem. And years and years and years and years ago, back when Jimi Hendrix and Janis Joplin were using, the purity of heroin was 8 to 10%.
Okay.
And it was expensive. Today, the purity of heroin is 80 to 90%, and it's not expensive. And so, and it's easy to get. The other thing is that heroin has moved to the suburbs. Why has it moved to the suburbs? Where is the money?
I know.
The money's in the suburbs. And the dealers know that, and they're enterprising individuals. And the other thing we know is that there's a typical progression from pills to heroin to other substances. We have a problem in this country with pain, and physicians that prescribe medication for pain, and I'm not going to get into the whole industry thing, but pain abatement is a problem. And Percocets and Oxycontin and oxycodone and those kind of things. And what happens with the drug dealer, when the doctor doesn't give you the medication anymore, you buy the drug downtown, and a pill of Percocet or oxycodone or Oxycontin would be $30 to $40 for a pill.
Yeah.
You can buy 4 bags of heroin for what
That's
it costs for 1 pill. So the drug dealer says, why don't you try the heroin? And then it has a higher purity, so you get addicted, and you snort it, and then the drug dealer says, listen, if you shoot it, it'll work more effectively. And the drug dealer basically drives the bus on getting you to be an IV drug user. And it's a problem. The other piece today is with fentanyl and chlorfentanyl, which is an elephant tranquilizer. It does not show up on typical drug screens. Now, at Phoenix Recovery Center, our drug screens will show fentanyl and cofentanyl.
Really?
But standard drug screens don't necessarily show it because it's a synthetic.
Okay.
It's a synthetic, and what happens is it's 4 times more lethal than normal heroin, and people are dying because of the fentanyl. And the drug dealers don't tell you that it's fentanyl or cofentanyl, and they sometimes cut it with other substances.
So why don't the drug dealers care that it's going to eventually come back to them and they're going to go to jail? They don't get arrested.
They don't get arrested.
Not for a long time.
But if they do get arrested, the court systems, if you go to the drug abatement program, you're back on the streets. And for every drug dealer that gets busted, there's 2 more that are on the street, because it's a way to make money. It's a way to make money.
So you said fentanyl and cofentanyl. What's the difference again?
One is just a different molecular structure.
Wow.
And today there's options. I mean, there's probably 100 ways to get clean and sober. Philosophically, at Phoenix Recovery Center, we believe abstinence is the best way.
Of course it is.
But there are methadone clinics, there are Suboxone clinics. The challenge with methadone is that it's synthetic heroin.
Right.
And the challenge with Suboxone is if you don't get counseling, there's morphine in the Suboxone, and you can become dependent on the Suboxone. Wow. So even if you're going to go on methadone or Suboxone, you should always get and stay committed to ongoing counseling, because so that you can address the behavioral aspects of the disease.
Well, thank you so much for sharing that with me. I appreciate that. And now I want you to, the camera that we identified before you came in, when you first sat down, I want you to take this time to speak to whoever you want to and share with us where we can find you in your center. So it's all yours. Okay.
Hi. What I'd like to do this afternoon is talk to the families of the sick and suffering alcoholic and addict. It is a family disease. I'm in recovery 23 years. I've worked in this field for 20 years. I've admitted over 1,000 people to treatment centers. I've talked to thousands and thousands of families. And the challenge today, and it always has been, with the family is to know what to do, when to do it. I often talk about Kenny Rogers' song, know when to hold them and when to fold them. We don't want our loved ones to die. We don't want our loved ones to end up in jail. The problem is, when do you say no? When do you cut the ties and say to the loved one, I can't do this anymore, you need to get help? That's a very personal decision. The challenge is that oftentimes families think they're helping by paying the rent, paying for the cell phone, giving them money supposedly for food. I even had families that go downtown and buy the drugs for the individual, or they'll make sure that they have the booze so they don't have the shakes. Right. The challenge is for a family is, when do you say no? When is enough enough? I will share with the families that you have every right to have a life, and you need to do what you need to do to help your person get into treatment, to touch the system. And if you can do that, then you've done the next right thing for yourself, and then it's up to the individual to do the work. But there is sobriety out there. There is freedom from drugs and alcohol out there, and it is a tough decision for the families. But the families need to do what they need to do to take care of themselves, and they also need to do what they need to do to help the person get into treatment. I often tell families that the loved one, you'll give them 150% if they'll get help. If they choose not to get help, you can't help them anymore. You can't have anything to do with them. Some people call that option reduction. Some people call it tough love. And when that occurs, all you can do is, when you get to that point, all you can do is pray. And when they reach out is to get them to the next step and to touch the system somehow.
Thank you so much for sharing that. I appreciate it.
Thank you.
So you heard it all. You heard it from a man who has been an addict himself, and he's hit rock bottom, made his way back up to healing, and he's in recovery, and now he's helping us, me and you, families, and those that have addicts in their families. So thank you so much for watching and listening, and please take heed to every word that you've heard today. I'm Toni Gorman, your Pathfinder. Thanks for watching.